talk a little bit about the route of a surgeon scientist career, except I'm not going to. And the reason I'm not going to is it's very different depending on what clinical specialty you're in and from and so on. So what I thought I'd do instead is talk a bit about what I think one needs to look for when choosing this career route and what the important features of a job should be if you choose to be a clinician scientist of some sort. And really, these are the things that I ran through in my mind when I was choosing this career route and choosing somewhere to work. Having said that, I'm in this job because there was a job and I needed a job as much as anything else. And I can say that because Xavier's not on the call. So the first thing when you're looking for a clinical academic career, I think, is the environment in which you work. So there's always plenty of money around, there's always plenty of projects around, there's always plenty of everything else you could need around, but there isn't always a supportive environment. And what does that mean? That means every element of where you go to work and the people you work with needs to lend itself to your kind of style and what you need to do to derive maximum value from the job, really. It's no good going somewhere where everybody's grumpy or everybody has different priorities to you, or is very money driven when you're not, or the other way around or something. And very quickly that becomes an obstacle to your progression if you don't have an environment that suits you and is supportive in some way. When you're starting out, you're completely reliant on the support offered to you. You really bring nothing to the table beyond enthusiasm. And if you're lucky, a good idea. Other than that, you're next to useless, is the reality of it. And that's the position I'm very much in. So you need an environment that's willing to accept that, and you feel is willing to accept that, and willing to facilitate your development in the direction you want to go. Because remember those questions we talked about in week 2, it has to be interesting to you, it has to be interesting to them. You have to be in a position where you can, kind of commit to it for a number of years perhaps. So a supportive environment is really key. The way to judge that is really, word of mouth from people you know and like and trust to an extent, trying to visit the department, looking at how the teams work together, joining meetings, seeing them at seminars and all that sort of stuff. But ultimately it is a bit of a gamble. And sometimes it pays off and sometimes it doesn't. So choosing a supportive environment, I think, is number one. So here you go. These were the things I thought came under that. So the facilities, every university has the same facilities: rooms, desks, computers, labs, people, software, all that sort of stuff. To my mind, they're all much of a muchness, and nowhere I've worked has really stood out as mind-blowing. Where things can be more helpful is things like grants management. So if you have a department or a division with a lot of support for submitting grants, for example, that's invaluable, because it is a bit of a challenge and a minefield to work your way through those. And if you're just dumped the paperwork and said, get on with it, good luck, that's not desperately helpful. And it's going to take you a couple of years just to get your feet off the ground from that point of view. So that's certainly something I've looked for is, am I going to join a team with people who have success in getting these grants and that will point me in the right direction? You think about proximity to collaborators. The University of Alaska, for example, might be fantastic, but if you're 1,000 miles from other people doing the sort of work you're into, that might make life a bit more difficult. So thinking about the work you want to move into, who are the movers and shakers in that field, and who might you want to work with in the future, or just meet to chew the fat regarding a particular topic, might be important. And we're very much in an era of team science. So I once heard it said that collaboration is the new competition. And I think nowadays, as the days go by, it's more and more true. The one-man band or one-person band and one team band are no more. Every study worth its salt is now multi-center, collaborative, lots of people involved in collecting and interpreting data. So you need a department that really allows you to engage in this team science and isn't going to be one that's like, no, me, us, no one else. And I think that's pretty easy to judge. You look at the sort of publication record, you look at their grant submissions, who are they working with, and how successful are they at doing that. So then the next thing I think is important is a mentor. And a mentor is, we all talk about mentorship in all sorts of different ways, but in research, I still think it's quite a closed shop unless you're in that world. And for all the thousands of websites and all this information that's out there, I still find it incredibly impenetrable to find out some of the most basic things about developing a research career. And I'm still not 100% sure how you go from, I'm still not sure how I did it, go from a clinician through this kind of pseudoscientist to suddenly noticing on my emails it says senior lecturer. And so you need a mentor who you can talk to honestly, and you need a mentor who's going to offer you kind of honest direction and so on, and not be afraid to say to you that an idea isn't worth pursuing, or there are going to be significant problems and so on. You don't need a mentor who just says yes to whatever. You don't need a mentor who just says no to whatever. And as I say, you need to be able to close the door in their office, if you like, and say, look, I'm totally lost, and not be fearsome of what's going to come back. Or, you kind of need a friend and an advocate and someone who's going to open doors or make introductions and so on to get you started, because every meaningful researcher on the planet had a mentor in some way, every single one. And if they say they didn't, they're just lying, because you can't submit big papers and big grants as a total nobody. So somebody always got the ball rolling for them and helped them out. So finding a mentor is key. And perhaps the most useful thing is someone who you feel you can sit and chat to more than anything else, and someone who I usually refer to like the sword on the side, like Professor G is the bigger weapon that I have to hit people with and to go to for advice and so on. So that, I think, is what you need from a mentor, and that mentor will change as time goes by. I've had several that change depending on where I am and what I'm doing, and there's no shame in that at all. And sometimes you have several at once for different things. And many of you will have had clinical mentors, for example, and an academic one. So I think that's important. And your unit should really be the place where your mentor works. Otherwise, there's a conflict of interest that might do you or them a disservice. So then protected time is another thing that I looked for, particularly when looking for a job. So people who don't do academics, or who are sort of token academics, singularly fail to appreciate, I think, the value of protected time for research. The fact is that what we do in academia takes a lot of time. And sometimes it's a lot of time where there's not always a lot of tangible output. If you go to theatre and you do an operation and it takes you 2 hours, you've done something and you can point to it at the end. With academia, sometimes months go by and there's nothing going out. Stuff is just moving along. Think about grant writing, really, that you don't see anything until you've got the money. And that can take a year, but it's a long, hard working year, or writing a paper, or collecting data, or validating data, or working the numbers and so on. But the fact is, you need, I think, to churn out good quality work and to make a career in it, you need some sort of protected time. What exactly that looks like is down to you, whether it's closely integrated with clinical work, very distinctly timetabled separately from clinical work. I don't know. It's whatever your department and works for you. But I think you need protected time to sit and do what you need to do, and protected time to think as well. You need time to sit and think quietly about ideas, about how you could work things, how you can approach things and so on. That is how science works. Hours and hours of kind of mulling and thinking and writing and trying before the genius idea arrives. And so if you go to a department and you find there isn't any of that, or as is very prone to happening within the NHS, your kind of protected academic time is whittled away by the needs of looking after patients, you have to think if that's the right sort of environment for you to achieve what you want to achieve in it. And it might be, or it might not be. So protected time is really essential. So wherever you end up, just think about what would your ideal clinical academic practice look like, and does that involve protected time? And if it does, you need to be fairly aggressive with it, because patients always end up coming first, right? And that side of your role will take up more time. So then there's work-life integration. And when I started off, someone once told me, so my timetable was 50-50. I'm supposed to be half academic, half clinical. Someone told me when I started, it won't be 50-50, but it'll be 100-100. And that's true. So, I have a full-time 10-session clinical job and a full-time 10-session academic job that I have to fit in 10 sessions, a session being 4 hours. And so it's incredibly difficult. There's evenings writing and working. I've just finished editing an issue of a journal this morning instead of, doing clinic duty and stuff like that. It's just really difficult. And so what you need to do is be aggressive about how you integrate your work and non-work life together. It's just a fact. It's not necessarily comfortable to do it, and sometimes you have to make difficult decisions. But this is the nature of a clinical academic job. And so, what does that mean? I think it means your kind of relationships and friends and life outside of work. You need to view your choosing a clinical academic career through that lens a bit. And we're lucky in that not a lot of academics happens on the weekends and not a lot of it happens overnight and so on. But it's always there, you know. And when I was particularly a junior doctor, you do a ward round, you do your day as a house officer, an SHO, do your TTAs, you'd kind of reach the end of it, you go home and that's it, unless you're working on an audit or something, I suppose. But with academics, it's kind of always there. There's no finish line until, your paper's in PubMed or well, not even receiving the money because you've still got to do the work, right? And I've struggled with that at times to go, well, where's the finish line? How do I know that I'm done? When can I put it down and go finish, right? Next thing. And that overlaps then into your life outside of work. And so you need understanding relationships and understanding kind of social support networks, I suppose, for your clinical academic career to be a success. Because there are times it's late nights and hard work and sweating and panic, although probably less than being a surgeon, to be honest. And there are times where it's very quiet and you can feel down that you haven't achieved anything very tangible. And particularly I found as a surgeon, quite a sort of practical job, I find that the hardest bit of the work-life integration is sitting there and going, what have I actually achieved today on an academic day? So thinking about that is important when you come to choosing this as a career. Compensation, the fact is, healthcare in this country is not brilliantly well paid. It's okay, but you're not going to be a millionaire doing this. And speaking again from a surgical perspective, in every minute you're doing academic work, you're not doing clinical work. Fine, the rate of pay is the same, but you're not doing private work, for example, where the rate of pay is a multiple higher. And so, you can do well financially out of it, but it is very difficult because you do have the obligation to deliver academic work, which, unless you invent something awesome, doesn't pay desperately well. And so think about that side of things. It's not the same the world over. There are parts of the world where your academic stuff is paid well, but you have to make some significant life choices to go to those places and work in them. So think about the compensation side of things. If you're fortunate and have piles of cash or sleep in a bed of money like Lauren does, then not an issue. But I certainly don't, and I'm quite conscious of that as my children get older, for example, which is a long way for some of you and maybe closer for others. I don't know. The other side of things is the compensation in terms of the clinical work, if you like. So I enjoy doing surgery. I enjoy looking after patients. That's really why I signed on the dotted line for undergrad and so on. And academic time does take that away. I do less clinics and less operating than some of my purely clinical colleagues, only some of them, frighteningly. And so, some of the reward I get out of being a surgeon is taken away because I choose to do the academic stuff. And the academic stuff has to be sufficient compensation in itself for you to kind of be happy with life. And so that's something that you've got to think about. And that fluctuates as well. There are years you can bang out 15 papers and you think you're untouchable. And there's some years where you might churn out none. So think about whether the academics is compensation in and of itself, as well as the money and the patients and all that sort of stuff. And so these are the elements I think, sort of come together to make a success. That's a surgeon scientist, but I think actually this applies to any sort of clinician and kind of trying to combine it with an academic career, be it a nurse, a physical therapist, surgeon, physician, OT, you name it. But they all come together to make it a success. And it is a challenging career path. And we said in week one, this is the harder route. And I know every specialty says that, but you've got to master your clinical career, which is hard enough. Then you have to master an academic career. And both those career routes have their own people who do that full time without distraction and still struggle to achieve. So it's not an easy route, but the rewards, I think, are more than double each of those on their own. Do you know what I mean? So you have to balance all those out. And you know what? There's more people balance it all out and go, nah, not for me, than there are go, yes, I can do it. I suppose the last thing, I think this is the last thing, yep. The last thing is this persistence and resilience idea. Now, I'm quite obsessed with this idea of resilience, and I can't put my finger on a definition that I really, really like. But it's kind of, it goes beyond the obvious of just kind of keep going, it will be okay, you'll get to the end eventually. It's the kind of fortitude to accept that there are good days, bad days, subpar days. Sometimes you feel like you're losing, sometimes you're winning, sometimes your paper gets in, sometimes it doesn't, and so on. It's just keeping hammering away. And it's, for me, it's dealing with that fluctuation. I'm okay if the trend is upwards, however slowly. I'm kind of okay if it's downwards, however slowly. But it's the up, down, up, down, up, down that me as an individual find very difficult to deal with. And developing persistence and resilience in an academic career is necessary because of so many reasons. But you do projects that don't go well, or suddenly get turned down, or you write papers that you put your heart and soul into and no one likes it, or you come up with an idea, you get to work only to find someone else, usually from China, has published it in the meantime, and so on. And so you need to think of strategies to overcome those and so on. And I think that persisting at it and being resilient to it, whatever that means for you as an individual, is a really key aspect of it, because it's definitely, as I say, not the easy route. Um, and you can have to flick from academic to clinical and back again, in a matter of minutes if a patient goes off, or if revisions need doing, or the professor rings at the last minute and gets you to arrange a teaching program, for example. You have to flick backwards and forwards and be reasonably tough about doing that. So those are the things that I thought of when taking up a clinical academic job at consultant level. And these are the things that we've sort of roughly covered over the last 12 weeks, really. And I'd just go back and say, if I had to pick one thing in this list that is really worth putting the effort in, it's that first one. It's that formulate a research question that can be answered. Without that, the whole house of cards, not only does it fall down, it's not worth building. And unless you can find a question that meets all those things we talked about at the start, you're interested and people are interested and it's answerable and so on, the whole experience just isn't worth going through. So spend weeks doing that, and